cannot keep doing what you've always done. It's got to be done differently. And now you need more insight, you need more research, you need to dig deeper. Online health searchers today are people who search for health information on the internet. They could be searching for themselves, they could be searching for somebody else, they could be searching post-diagnoses, they could be searching just experiencing symptoms, or they could just be doing it for entertainment. So the trends that's happening right now with the online health searchers, it's a question of empowerment, and people want to take control of their health. So it's the same reason why mobile technology is being so much more effective, is because people want certain things when they want it, and how they want it. So with the trends that's happening right now, it's really so much about empowerment and how things are evolving in that genre. When people take more control, they feel more confident, so they want to educate themselves, they want to become more aware of their health, of their condition, of what's out there, and by becoming more knowledgeable about their particular illness or even their symptoms, they can have a different level of communication with their medical professional, whether it's a GP or a nurse or what have you. So it's a question of control, taking control of your health and becoming more empowered with it. So semiotics, what it is really it's the study of signs and symbols. It's the triggers, a study of the cultural signs and symbols that stimulate people to think in a certain way. And it's a deep analysis and a deep insight into what motivates or what triggers a certain thought and how to react to it. So what it does is it helps understand the patient, helps understand the patient's thinking, so what they're thinking at that frame, in that frame of mind, at that point in time, suffering or experiencing, whether they're experiencing symptoms or whether they're experiencing certain illnesses. So with that frame of mind, they're impaired, so it's not a natural frame of thought like somebody who's completely healthy. Using semiotics and with branding and marketing, the idea is all about understanding not just what the patient or the consumer or the individual even is thinking at that point in time, but understanding also how you're going to communicate to that individual or patient with that frame of thinking. So they are in an impaired mode of thinking, so when you want to communicate a certain thing to them, you need to understand that they're going to view it in different eyes than you're going to view it. So it's really all about understanding the cultural signs and symbols that trigger their frame of thinking and their way of thinking in that state of mind. So a lot of marketers today are starting to change that and starting to look into that and starting to become more aware that in today's global economy, competition is so fierce and so strict that if you don't make that change, you cannot keep doing what you've always done. It's got to be done differently, and now you need more insight, you need more research, you need to dig deeper. If you go back a little bit further, there was a lot of fear-mongering from different areas of the medical community in terms of be careful not to go online and search for health information because you can misdiagnose, you can miseducate and misunderstand what's going on, you can panic. So cyberchondria is all about things like that. So can you panic about a particular illness? So you've got a headache, you go online and you search for a particular illness, and suddenly one of the things it lists as a potential illness is cancer, and so you think, oh great, so I've got cancer. Well, that was then. Today, people are so much more savvier and they are not so clueless. So people understand that it may not just be cancer, it could be cancer, but there are other things. So they're going to dig deeper, and people today are much more savvy. So, and the medical community is catching up. So now the doctor-patient relationship has changed. So there is a sense of respect both ways. So it's really building bridges, and through knowledge and education, that's going to change everything in the future.